over 9,500 people in the US were diagnosed with skin cancer. And although it's one of the most preventable forms of cancer, it's also one of the most common. Usually, it's caused by UV radiation, or UVR. So it's ultraviolet rays coming from our sun. There is a danger though to this, and so today what we're going to talk about is the importance of taking precautions to prevent skin damage and the cancers caused by UVR. So first, let's take a look at some basic kind of facts and statistics. So according to an article entitled Skin Cancer by the Skin Cancer Foundation, over 9,500 were diagnosed today. 1 in 5 Americans are diagnosed by the age of 70. And it is associated with about 90% of non-melanoma skin cancers. Every month, about 5,400 deaths occur because of these cancers. What is skin cancer though? So another article entitled Skin Cancer by the Mayo Clinic explains that skin cancer is a normal growth of cells that invades and then destroys healthy tissues. The most common types are basal cell carcinoma and squamous cell carcinoma. The most dangerous is melanoma. Most though are due to sun exposure. And so these are what the 3 types will look like. That is melanoma on the left, often dark, and it's pretty easy to tell apart from the other 2. And that is squamous cell and basal cell on the middle and right. The culprit, or the problem, this is UV radiation. So according to an article entitled Ultraviolet Radiation by the World Health Organization, the danger is that we don't see or really feel UV radiation, but we're all exposed on a daily basis. So UVR, this is a photo actually, and so using special lenses, we're able to see damage that, according to just a normal human eye, is invisible. However, this will appear in time. So these are young people that they're taking photos of. The damage already exists. So the dark spots, that is damage done by the sun. However, you won't see it until much later in life, but you can see it now. This causes DNA damage, it causes sunburns, it can cause allergic reactions, suppression of the immune system, as well as the cancers we discussed previously and premature skin aging. Now, there are risk factors. So according to an article entitled Risks and Causes of Non-Melanoma Skin Cancer by Cancer Research UK, first off, a history of skin damage. So sunburns, maybe several sunburns as a child, or working for years outside in the sun, that is a risk factor, as well as having fair skin, less melanin, less natural protection. And the use of sunbeds or indoor tanning. So this can cause melanoma and it greatly increases your risk. Finally, how can we prevent these effects and hopefully heal the damage that's already been done? So, one great tip is staying away from the sun unnecessarily, staying in the shade, covering up by wearing long sleeves, a hat, and sunglasses, and trying your best to always use SPF with 30 or higher. And so this kind of is a nice little way to remember. So slip on long sleeves, slap on sunscreen, slap on a hat, seek shade, and slide on sunglasses. Now, according to another article entitled Skin Cancer by the Cleveland Clinic, there are a few more tips. So staying out of the sun during peak sun hours, 10 a.m. to 4 p.m., as well as being aware of possibly photosensitivity. There are some medications that can increase your sensitivity to the sun, as well as remembering SPF lip balm. So that's one area we don't usually think of. However, your lips are also exposed as the rest of your face is, and so you want to protect that as well with SPF. So they now make lip balms that have it, and so you can use that and help protect yourself. Now, there is also a possible treatment. So according to an article entitled "A Baseline Liposome-Based Temperature-Sensitive Hydrogel for Treating Ultraviolet-Induced Skin Damage" in the International Journal of Nanomedicine, there is a possible treatment for both existing damage and that can help protect us against current possible damage. And so it can help protect us against UVB photo damage, inflammation, and the damage that we get on a day-to-day basis. It also, though, can possibly help with damage that's already been done over the years. And so that's a possible treatment for those who already have existing damage due to the sun's rays. Now, in summary, UV radiation has been causing thousands of deaths for many years, whether it's from skin damage or cancer, and it's sadly often preventable if certain precautions are taken, such as covering up, avoiding prolonged exposure, and using SPF. We all want to live long, happy, healthy lives. So let's please do everything we can to make sure that becomes a reality by just taking some simple precautions, telling others what they can do, and just remembering that sometimes that's all it takes to save a life. Thank you.